Hi, it's Dr. Noel Williams, October 28th, 2020, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update. The focus is pretty solely on Oklahoma. I'll give a brief thing about the United States. 80,000 new cases roughly yesterday. We're going to go on pace probably to hit 100,000 is what I'm thinking in the next few weeks. So let's talk about Oklahoma. I'm making some changes in my recommendations. Not huge ones, but there's some changes, and not on the supplements, but on where we are. We had our COVID task force meeting today. Great group of doctors. We'd expanded the group and invited some other people to join us. And one of them was Dr. Dale Bratzler, who's at OU Public Health. He is a physician and has a master's in public health. He clearly, after listening to him talk off and on for an hour, is a brilliant person and knows a lot about infectious disease and epidemiology. Then we also had three of the busiest infectious disease doctors in the city, Jim Kirk out of Saints, I believe, and then David Chansom out of Integris, and Dr. Linda Salinas, from OU, who's been leading the task force. And her claim to fame was she was the one who essentially closed down the MBA. Everyone joked about that in our meeting. That would be a lot of pressure to have on you, as a person. So, and then we had our usual group of brilliant CMOs, CEOs, and other assorted people who are brilliant. So what did we learn today? Well, we got up-to-date numbers. And the up-to-date numbers is we have about 120,000 COVID cases, and we're about 1,300 deaths. So if you project back, and again, I'm quoting if I sound intelligent, I'm just repeating what Dr. Bratzler said, who is one heck of a smart human. So we were thrilled to have him, and I'd heard that, and that's why we invited him, but he was very impressive. If you would have heard in January, at the end of January, hey, we're about to have 34 weeks of this pandemic, and on average, it's going to infect 3,500 people a week and kill 38 Oklahomans and put another, couple hundred in the hospital a week, or 150, 200, 300. Would have you believed that? And it would cause massive economic destruction and health misery. I don't think any of us would have believed we were in for 34 weeks of that. And this is the problem. It's going to continue. And looking at the numbers we have now and where the hospital systems are, we have to make some unfortunate but necessary regressive changes in our decision in how we're approaching this, because we are going to overwhelm the hospitals. And we are going to get into a position where we surge, and we're going to be overwhelmed between just the COVID alone plus flu, and we can't turn off the services and let harm come to people by only taking care of COVID patients. So we have to limit the number of influenza and COVID patients as best we can. And so, interestingly enough, a study is in preprint out of the University of Kansas looking at mask wearing by county. So what they did, and Dr. Bratzler presented this, and I'm simplifying it, but it's the first study that really looked in a non-biased way at mask wearing by county. And what they did is they compared the counties that mandated it to the counties that didn't, and keeping all things otherwise equal in terms of testing centers, all that kind of stuff. And the study was done by the University of Kansas Medical School and School of Economics, because they're trying to find business impact stuff on this too. And it turns out that the counties that mandated masks had a more than 40% reduction in infections or documented infections. And again, that's a big change. And so as we look now at where we are with COVID, where it's proliferating and it's much more available to get infected by, we had not had that data. And we have that data now, so that makes me adjust, because I'm a big believer in when you have science, you follow it. There's no point in doing it if you don't. And so if it was a 10% change or a 15% change, that wouldn't be that much. Over a 40% change in infection rates is massive, and it was across the entire state looking at all these different counties, and it was uniform comparing all the counties with masks to not masks. So even though the virus is more infective, potentially right now, and there's more, because of more particles, if we can get any level of substantial decrease in transmission, we have to jump on it. So I think the number one thing we need to do is get very, very focused on mask wearing again. And we have to get over the fatigue we were all feeling. And it means actually wearing it and not pulling it down. Number two, we have to limit our group sizes. We have to stay more than 6 feet away from each other and really start limiting our going to stores and, unfortunately, going to restaurants and going to bars. And I'm sorry to have to tell you that, but as the cases are skyrocketing and there are no hospital beds, there's not a good outpatient treatment strategy other than what a few doctors in the community do. The inpatient treatment strategies are fantastic. I would put our care at any hospital, whether it's Norman, Midwest City, OU. Listening to these people talk, they're incredible. Mercy, Integris, St. Anthony's, any of them. Any of those facilities, any of the Central Oklahoma medical facilities are absolutely fantastic. But you don't want to get there. But some people are going to get there. And if there's no beds, they're screwed. Likewise, if you have a heart attack and there's no beds, you're screwed. If you have bad influenza, you're screwed. So we have to do regressive strategies in Oklahoma. I don't know if we need to do them everywhere in the country where the cases are lighter, and they have opportunity to take care of people. But the bottom line is this: if we don't modulate what we're doing, we're going to overcome our ability to care for patients, and there's going to be a lot of people who could die. And for those of you that think, well, we just need to do herd immunity and we'll be fine, Dr. Bratzler went through those statistics. To get to a 60% herd immunity rate, which is not sufficient, it needs to be 70, it's projected that's on pace to give us 7,200 to 8,000 deaths. So we'll probably be 8,500 to 9,000. That's about almost 1 in 500 Oklahomans dying. And while that may not seem like that many to you, it's a lot to me as a physician. And since I know a lot of people, it means people I know will die. And I don't want anyone to die of COVID, let alone die of something else. So it will become much more personal because you have to remember that for every person who dies, there's 99 other people who got infected, and probably 20 of them are going to be more seriously infected, and some of them are going to have damage. We had someone in today who's a few weeks out and has really serious, she had a telemedicine visit today because we were closed, but who has some really serious dysfunctions from the COVID that we're having to work up with a head MRI and do all this stuff to try to figure out what the heck happened to her. And so that's my point. We have to be conservative. Take your vitamins, do your healthy choices, but part of the healthy choices is being way careful now. We have to get back in the mindset we had in March, at the end of March or April, really, where we really did very well. And we need to maintain that mindset for the next couple months to blunt the curve again. And again, I'm sorry I'm having to tell you this, but I was overwhelmed with data today. And it was very, very smart people who are in the thick of the fight, doing everything they can. And we want people to do well in the state of Oklahoma. So let's be conservative and careful and really mind your cleanliness, wash your hands, wear your mask, limit your contacts. Think a lot about Thanksgiving, how you're going to do that. Don't be around sick people. If you hear a relative has a cough or cold, that cough or cold could be COVID. I'm sorry, you got to be careful. So again, stay away from sick people. That would be my other advice. So that's about it. Kim, do you have anything more uplifting?
Unfortunately, I do not.
I'm sorry. But now on the other hand, all these people are highly motivated. They're thinking through stuff. The state has gotten wonderfully organized in terms of the hospitals, using the trauma coordination. They're communicating. They're very integrated in central Oklahoma. We heard rave reports about some of the things St. Francis was doing in Tulsa today. So the hospitals are doing their part. So let's just all do our part too. Big shout out to everyone at OG&E, DJ Morgan, who's a family friend who's out there working, all those people. A big hello to Dr. Jackson Sullivan, who did my sort of root canal today. And it was something in between. I didn't really understand what it was. But anyway, so thanks, Dr. Sullivan. And a big shout out to my team at Optimal Health Associates, who's doing great, who did telemedicine visits for patients all day. We took care of some new COVID patients today that are in our practice and contacted us. So a big thank you to my team and my director and my partners, Cassie Smith and Ben Berenberg, for all their hard work. So do your part.
The only other thing
Oh,
to
hold
mention
on.
might be if you want to send a message on the Facebook page or ask questions, that there's a difference. There's Noel R. Williams, MD, which is your page, and the one that just says Noel Williams is our son.
Oh, yes. My son, Noel Williams, is a dentist. So, and
He's getting your message.
he gets our messages and medical requests. So if it just says Noel Williams and there's not an MD after it, it's not me. And so he doesn't look at his Facebook page that much. And so if he sees a medical question, he'll usually tell the person, but that's not his job. So make sure if you're messaging anything, and again, if it's like an acute medical problem, you call the office, don't Facebook it. But if you have a question about COVID or something, Facebook me, not him, because he really doesn't want to answer COVID questions and it kind of bugs him. It's the curse of being my child. So anyway, you all be safe. Sorry I rambled here at the end. Take your vitamins. Good night.